Hi, this is Paul Testa with the Health Policy Program of the New American Foundation, and I'm here today with Jon Rasmussen, the Chief of Clinical Pharmacology, Cardiovascular Services at Kaiser Permanente Colorado. And I'm very excited to be here with Jon today because we are going to talk about a sort of real-world example of how health IT and health information technology can transform the management and treatment of very complex and often costly and often deadly diseases, specifically in this case cardiac disease or heart disease. And we're here today, Jon, if you could maybe describe to us this program of the collaborative cardiovascular care service that Kaiser Permanente Colorado has instituted. Maybe sort of what was the impetus for it, how you implemented it, and sort of what are maybe some of the results of this program. So,
about 10 years ago at Kaiser Permanente, we recognized that our patients with heart disease were not getting the appropriate long-term follow-up that they needed to stay healthy. So at that time, a team of physicians and cardiologists, nurses, and clinical pharmacists got together to see if we could design a system that would ensure that our patients stayed healthy and alive long-term. The program that we've designed is a seamless integration of care for our patients who have heart disease. So as the patient is admitted to the hospital with a heart attack perhaps, a member of our nursing team immediately contacts that patient and starts to work on lifestyle modifications such as diet, exercise, smoking cessation. Also, a clinical pharmacy team works with that patient to make sure that they're taking the appropriate medication to improve their heart health long term. As long as a patient is a member of Kaiser Permanente, they are going to have follow-up by our collaborative cardiac care service team.
And then you've instituted this program 10 years now, so you clearly have some data to look at. What have been some of the results, both on the sort of outcome side and also maybe on the process side?
As far as the process side, what we wanted to do for the patients is to make it as seamless as possible. We didn't want to have them make any extra effort dealing with an extraordinarily difficult disease anyway to have to seek out care. So we made sure that this process is seamless to the patient, from the hospital to the nursing staff to the pharmacy staff. The patient has to do nothing. We contact them, in most cases over the telephone, to discuss their care. So they're able to get this care at home. As far as clinical outcomes measures, which is, of course, the be-all, end-all, are we keeping people healthy and are we keeping people alive? What we've discovered is that if a patient has a heart attack and they're enrolled in our service within 90 days of that heart attack, they have an 89% decreased risk of dying. Even if a patient has a heart attack 5 years ago outside of Kaiser Permanente, yet becomes a member, we will still enroll that patient in our service. Even though they've had a heart attack years ago, if they're enrolled in our service, we'll decrease their risk of dying by 76%.
That's a good deal. In terms of maybe just ensuring that they're getting the right care, what have you found with this program? Ensuring that they're having their cholesterol monitored, things like that. What have been some of the results?
We focus on certain risk areas, and those include cholesterol, blood pressure control, diabetes control, smoking cessation, and some other medications that have been shown to decrease the risk of having another cardiac event. If you look in the medical literature, it's expected that only 50% of patients will continue to take their cholesterol medication, for example, 1 year after they have a heart attack. That's abysmal. With our program, we've demonstrated that 85% of patients remain on their medications at 1 year, and if you look out 4 years, 75% of those patients remain on their medications.
Nice. Maybe shifting gears a little bit, Kaiser Permanente is somewhat unique in that it has this really robust, well-developed kind of health information technology already in place with a very kind of multifunctional electronic medical record. How important is that to the work you do? Would it be possible to do it without a fully functioning integrated electronic system?
The system, the health information technology that we have is really essential, an important piece of what we do. We understand that, to mix medical metaphors here, what we do isn't brain surgery. We've just taken established medical interventions and applied them consistently using a team-based approach. The electronic medical record, health information technology, has really been that special sauce for us that it's allowed us to scale our program to a much greater level than we would have ever been able to with just paper charts. It's also allowed the different team members to communicate electronically and be in geographically different areas. So the ability to transfer this type of service to perhaps rural Montana exists. We do most of our care over the telephone.
Amazing. In terms of changing the way you do care, I think healthcare in America is often described as a series of silos. How difficult was it to break down these silos, break down the walls between the doctors, the pharmacists, the nurses, and what are some lessons to be learned and keys moving forward as we look to transform our healthcare system?
So we certainly had to address the culture of healthcare in Kaiser Permanente when we started this service. We recognized that physicians, nurses, and clinical pharmacists could be siloed. So we up front had to recognize that each member of the team, for it to work well, was going to have to do what they do best. Allow the experts in that area to be the experts in a team-based approach. When we started to see results that I described a little earlier, that made it that much easier to go back to other team members and say, look what we've done using a team-based approach, working together as a healthcare team for our patients.
Talk about results, and I think one of these sort of aha moments of health reform is that better quality care is often the most cost-efficient care. And I know you have some research of your own that you're publishing in the future, but maybe could you give us a teaser, just a hint of some of the sort of the cost side of this program?
Sure. We understood when we started this program that quality was something we needed to demonstrate. At the same time, though, we're pragmatic enough to understand that if it costs a lot of money to do it, it wasn't going to be successful long term. So we've studied these patients to see, do we in fact reduce the cost of care? And using National Committee for Quality Assurance data, we estimate that we save $3 million a year in hospitalizations alone. Now, we've done our own research that we hope to publish this year, and just to give you a little teaser, it's more than the NCQA estimates.
Excellent. Well, I look forward to that, and we're very glad to have had the chance to sit down with you. Thank you so much, John.
Great. Thank you.
Great.